Welcome to the ATS Breathe Easy, the latest podcast. Here's your host, Patti Tripathi.
Hello and welcome. This episode is part of our What You Missed at ATS 2025 series. Joining me shortly is Donna Appell, the outgoing chair of the ATS Public Advisory Roundtable. She's also the executive director of the HPS Network, Hermansky-Pudlak Syndrome, a rare genetic disorder. Here are the latest headlines. New findings at the 2025 American Thoracic Society ATS International Conference suggest that cancer treatment methotrexate may be considered an effective alternative remedy to prednisone for pulmonary sarcoidosis, a common form of lung disease characterized by the formation of inflammatory cell clusters in the lungs. Rising temperatures are said to make obstructive sleep apnea worse. That's according to a large new study presented at the ATS 2025 International Conference. The study also found that under the most likely climate change scenarios, the societal burden of obstructive sleep disorder is expected to double in most countries over the next 75 years. The wait list for lung transplants have significantly improved because of new allocation guidelines. It prioritizes medical urgency, according to findings from a recent study. We'll be right back.
Did you miss the ATS 2025 International Conference in San Francisco? We've got you covered. With the ATS Conference Highlights package, you can access inspiring presentations as well as valuable clinical insights from pulmonary, critical care, and sleep sessions. Members get a discount, so become an ATS member or renew your membership to take advantage of these savings. Go to conference.thoracic.org today.
Donna, it's so nice to have you here.
Thank you for having me.
And you've been coming here for almost 3+ decades.
I started with the ATS in 2002.
And this is...
I was only 10 at the time. No, I'm kidding.
Yes. And before I get some background information, you are the past chair, and tell me what you accomplished this year.
It's been an exciting year, and certainly at this conference, we were really, really pleased to have awarded 19 travel awards. So for the Public Advisory Roundtable, we get the ability to give travel money, like $500, to help people in their young career to come to the ATS. And they get awarded that by giving the best abstracts. They get picked by ATS as the really good abstracts to showcase and have them come. So we had a wonderful reception, and each one of these presenters had to give their talk with a slide, and they actually had to give it in lay language. It was a challenge for them to go non-scientific and actually give it to our PAR members, the lay language, the lay public. So we, together as a PAR organization, the Public Advisory Roundtable, gave a $9,500 worth of money to bring people and help people come to the ATS. We were very proud. There were 19 presentations. It was such a cool event. And it was like really wonderful understanding what they're talking about, because they spoke to us. A lot of us have a lot of medical knowledge. I myself am an ICU nurse, so, we're kind of understand a lot, but they did a really good job speaking to us. And we were very, very proud. We had a dinner for them. We were really proud to have them with us.
So what is the general reason the Public Advisory Roundtable exists?
The ATS is an extraordinary society. Basically, the Public Advisory Roundtable is the voice of the patient. We speak to the ATS and are the heart, kind of, maybe we could say, the patients that they are working for. The ATS was way ahead of its time, way ahead of its time. This is back in 2001 that they decided that they were going to put patients in the society. But it's not only that we're here in the society, we're given seats on the committees, we're given a seat at the board of directors, we're given a booth at the exhibit floor, we are given, they are so kind to us that we have a voice in almost everything that they do. And I actually think that it's really a way that patients and our patient organizations can applaud and encourage and hopefully inspire these very exhausted physicians, especially during a time of chaos right now. I think it gives us the chance to just really remind them that we need them so much and that we care about them and we want them supported, and that it's a symbiotic relationship. They give us a chance, especially for my organization. I'm the executive director of the Hermansky-Pudlak Syndrome Network, very rare disease. Who the heck heard of it? I came to the ATS because I needed to have pulmonologists, a subspecialist, learn about our disorder. But the American Thoracic Society gave me a chance to sit at the table with the big boys. And I got the opportunity to have a return on investment that was immeasurable. Another thing that the ATS accomplishes, and the PAR groups get to partner with the ATS on partnership and research grants. So we give some money, ATS doubles that money, and then does all the back end care of that grant. They do peer review, they get us good science, and we are able to work that together. And the Public Advisory Roundtable has done that for years. I think I'm on my 8th go round with doing these grants. And where else could you have that opportunity? And there are other organizations that try to get patients involved, but this isn't getting patients involved. This is embedding patients in your society. And they do it in such a way that we're welcomed, we're a part of this place. 2002, and I haven't left yet. So it's such a special society to be around. It's just wonderful. I hope they realize how grateful we are.
It's step back because you get so emotional.
I do. I get so excited about the ATS.
And you got involved because of your daughter. And
yeah. I had to choose. I needed to fix Hermansky-Pudlak syndrome. I am very desperately trying to find a cure for the pulmonary fibrosis of HPS. And I needed to figure out how to get pulmonologists involved in researching. And funny, silly story, but in the very beginning, I looked and said, where should I go? Where are these doctors? And I saw that they have societies, and I looked at, different societies. There's another society of these doctors, but it's much more clinical. And then there's more a public one like the ALA. But ATS was perfect because it had bench scientists. I want bench researchers, and I want, clinicians. And so I want a combination of all of them. So I couldn't afford to come here because we're a small disease. We didn't have any money. So I made a scientific poster, and this was back in the Atlanta conference, long time ago. And I got the poster, and I came to the conference, and I got duct tape, and I looked at the most traveled escalator that these doctors were running down. And I duct taped my scientific poster on the escalator side. And I sat there for a couple of days, kind of running after the doctors as they passed with some hard candy, hoping that they would listen to me, and gave them a brochure. And lo and behold, like somebody from the Dr. Bill Martin, who founded the Public Advisory Roundtable, and there was John Walsh was a member of the Public Roundtable, and they were having their inaugural dinner. So John came out to me and said, "What the heck are you doing here? What are you doing here?" And I explained, I'm trying to cure this disease. And he invited me into the Public Advisory Roundtable, first dinner, and it's been history from there. I've been president, a chairperson twice, and I've been here for the long term.
And that's good and bad, because that means you haven't accomplished what you had hoped over 30 years.
No, I need to cure this disease. I need to get a treatment. So I've been at this for 30 years and we don't have a treatment yet. But I have a booth with HPS people with me, young people with me, and I love to bring them here to ATS because I make them look around the exhibit floor and this whole venue, and I show them how many people care and how many people are working on this. And it's medicinal. That's hope in itself. That keeps us feeling loved and secure. And even though we don't have a treatment yet, we feel like there's a chance. We have a chance. People talk to us, listen to us. We feel very loved here. And it's an extremely medicinal event for us. It kind of gets us going all year long.
I met your daughter. You called it, you don't like calling her albino, but albinism. And I would have never guessed that. And that she's afflicted with that. And she suffers from blindness, you said. And there are 13 different varieties.
There's 11. We have 11 genes, but more coming.
Yes.
And it's very, the phenotype, the look of HPS is people that look very, very fair with very, very, white, light hair, all the way to people that can have brown hair and brown eyes.
Yes.
But they might be definitely lighter than their family members or siblings.
I see.
So it's an oculocutaneous, it's eye and skin albinism.
Yeah.
And they're legally blind. They do see, they just have a little eye jiggle, and they are legally blind. They don't drive. So we're really getting a kick out of, we had a lovely time in San Francisco with those Wago cars or whatever they are, because they can't drive. So we like these driverless machines out here. But they are very accomplished. They got through, get through college, they do fine, but they just have a vision impairment. But they have a lot of chronic illness, so they have a lot to deal with. And I'll tell you, they're beautiful singers. We should sing for you sometime.
Yes, I would love that.
Oh my God, they're beautiful singers.
And why is it that Puerto Rico has such a high number of Hermansky-Pudlak?
Yeah, there's a genetic founder's effect on the island. The island's surrounded by water, so the gene populates up because people kind of marry and, their own people on the island. So it's carried 1 out of 21 in large areas of the island. It's very, very prevalent. The prevalence is similar to the prevalence of cystic fibrosis or Tay-Sachs or sickle cell. That's very prevalent in that population in Puerto Rico. So we do a lot of work there. That was another, you talk about my love and my passion, you hear my passion for ATS. I was here and I wanted to do something for the island of Puerto Rico. We needed to raise the standard of care for HPS and pulmonary fibrosis there. And I looked up the doctors that are around the ATS. And I saw that Dr. Jesse Roman trained in Puerto Rico. So we spent a couple of years at the ATS conferences kind of trailing him and like tracking him down and kind of like walking in front of him. And then, started to make a conversation. And we asked him if he would help us with a comprehensive care clinic, with a lung clinic in Puerto Rico. And he agreed. And now he's absolutely shepherded and a wonderful doctor that we have a clinic every 3 to 4 months in Puerto Rico, multidisciplinary, that sees 30 to 40 patients in a day in Puerto Rico. And we've been doing that since 2016. And it's from Dr. Roman, it's just from being at the ATS. It's immeasurable, the return on investment for nonprofits, our disease groups, to be here.
And what were the symptoms in the beginning? I'm sure it's misdiagnosed quite often? What were the symptoms?
Yeah, being on, talking about the ATS, it's very, very underdiagnosed because people think of it as, asthma. And also I've had a lot of people be diagnosed with, pulmonary fibrosis, but they never connected the dots that the people have albinism and pulmonary fibrosis, and that equals Hermansky-Pudlak syndrome. When I first came here, the urgency was to diagnose pulmonary fibrosis. They were doing a biopsy, so an excisional biopsy of lungs. But our people they don't have a platelet function, so they bleed very badly. So we lost several people exsanguinating from the biopsy to diagnose the lung disease. And in Hermansky-Pudlak syndrome, you don't need that, and they're not doing that much anymore anyway. But if you have albinism and you have a CAT scan, a high-resolution CAT scan showing pulmonary fibrosis, you've got Hermansky-Pudlak syndrome. You don't need anything more.
And it's taken a while to understand that.
Well, not to the experts here. They catch on pretty quickly. And plus I had a booth of people with albinism, and doctors would walk by and, wonder why is there a booth of people with albinism at ATS. So we, got people to understand quickly, and they're so smart here. So in a way it's preaching to the choir, but there are people from other countries coming. There's all sorts of, and the student scholar program. We at the Public Advisory Roundtable run a program called PAR Path. And so our booths are set up in a row in an area of the exhibit hall. And the student scholars were amazing this year. They were really intelligent and engaged. And they come to our PAR Path, and they do like a shotgun, like a golf when you shotgun at different holes. But everybody, like a group of 9 of them, would start at one booth and 9 at another booth. And then we ring the chimes, and everybody switches places every 9 minutes and goes to the
like
next
a musical chair.
Absolutely, and they get to learn from all of our disease groups. And we have incredible team. We have ARDS, we have Vasculitis Foundation, we have the Pulmonary Fibrosis Warriors, we have Right to Breathe, Asthma and Allergy Network, Pulmonary Hypertension Association, Alpha One, the Foundation for Sarcoidosis Research, Alveolar Capillary Dysplasia Association, Pulmonary Alveolar Proteinosis. We have Access Advocates, which is sickle cell. They're new this year. We have the TS Alliance, the Lung Transplant Foundation, and the COPD Foundation. We rock. And the ATS gives us,
so many
oh my
of
God,
them I've never heard of. So
it's
many
amazing.
of them.
But the ATS is so cool that they give us the opportunity to meet here, have a booth, and do work and work. And it's truly symbiotic. Like we had great patient speakers this year at the ITS. If anybody missed them, they were amazing. But they spoke and opened sessions at the ATS that they hear a patient story, because ATS puts patients in the spotlight so that it makes everybody realize and remember why they're all here.
Yeah, I did interview Len Geiger. I don't know if he was...
Len, yes, absolutely.
He was a great interview, very inspiring man. So what do you hope to accomplish now?
With PAR, I think I'm really excited to be continuing working with PAR. I think I'm there for another 3 years before I rotate off again and maybe come back. Like you have to rotate off for a while and then you can reapply.
Yeah.
I might be 95 when I reapply. No, I'm kidding. So I'm not retiring. But I think that I would really like this year for us to focus. I'm still on the executive committee of PAR, and I'd like to focus on how to involve the PhDs even more. Like, I think it would be really great to kind of get them understanding how much we really care about their research, because I don't think they get to see patients as much as the clinicians.
Yeah.
Right? The clinicians get to see us.
Is
the
it
PhDs.
Frustrating to hear about all these cuts?
I have cried 2 or 3 times. I'm going to cry again. 2 or 3 times a day I've cried over the situation for multiple reasons. My heart breaks for the doctors that we love and are loved, like at the NIH and the EDUs and the academia that are being so affected by this. My heart breaks for them because they don't even get enough. Like, they don't get enough accolades. They don't get enough rewards. They don't get enough encouragement. And now we're going to just bring them to their knees. It's just absolutely heart-wrenching. So I feel so sad for them, first and foremost. I have to say that we've been working for a long time trying to find a disease, and we're really close. We have a couple of balls up in the air for close possible drug trials and stuff. And now, after all of this, we're not going to get the funding we need to like cross the finish line. And it's just frightening and heart-wrenching. But I feel like we need to just, I think we need to do both things. We need to change the things that we can change. Like, we need to get out there, and I've written letters, we need to do what we can. Our organization spent a lot of time with 3 videographers videoing short stories about what science means to us. I think we need to educate the public. The public doesn't understand why this is bad. So we need to spend time. I'm not sure how easy it's going to be to fight the political battle, but we need to work with the people and get the people to understand the issues. And at the same time, we can't get our eye off the ball. I have to keep moving. I have to accept the day that I'm in and try to cure this disease. I have to keep focused and moving forward. And if that means moving to the left, moving around it, or going over it or under it, I have to figure out how to keep my organization calm, because in our heartbreak for all of our scientists, I also had to quell the panic in my organization. People that depend on science and depend on the work that everybody's doing were panicked. So I think we need to work as hard as we can to do what we can to fix this. And at the same time, we need to stay focused and keep putting one foot in front of the other and keep moving.
My father is a senior scientist. He's a PhD, and they don't do this for money.
Oh, God, no.
They just do it to advance society, advance knowledge, advance, cures, and 3 or 4 decades of the same work, hoping that something's gonna hit.
Yeah.
So what else would you like to tell us?
I'm just really, I loved the international conference. It was great.
Yeah.
It was almost great to be here because what makes it so special, what makes it different than being on Zoom with people, is all the water cooler talks. It's all the time that you get to be here and chat with doctors that are experts in the field. Like, you can't get experts until you're here. Like, you can touch them, you can say hello to them, you can high five them, and it's an incredible opportunity. The sidebar talks. I can tell you that the international conference this year was a bit of a roller coaster, because I think I cried 3 times a day, but I got excited 3 times a day as well.
Because of advancements?
Because of advancement, because of things. The science is like super incredible. The RIS, the innovation meeting, and the first day on that first Friday was incredible, Friday and Saturday. So there's so much hope. Like I said, I bring the girls here because there's so much to see and so much hope, and looking at the posters, and that's always so uplifting. So it was a roller coaster. and not to be missed. I have not missed one except, COVID went but I've been here since 2002.
Anything else you'd like to add?
No, but I appreciate you and this opportunity, and I love you interviewing and doing our podcast because you're wonderful, and I think that it's really great meeting the people and speaking with you, and I just appreciate that.
You're such a lovely person, and thank you so much for the time that that you've given today, and hope to see you again soon.
Thank you.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.